what you do is exhaust it. Because what I've learned about cancer is it's extremely clever, extremely powerful, clever.
Clever. Okay.
Clever. I mean,
It is.
you can get the latest, greatest chemotherapy, right? And you give it, your whole body's falling apart, your hair falls out, your skin is, the cancer cells after 2 or 3 doses say, that's fine, give me more. Right. So they easily become resistant, and we don't. So we're dealing with a formidable situation here. So what we need to do is just don't try to outsmart it, don't try to exhaust it. And so you're giving it this 3 days on Monday, Wednesday, Friday, this on Tuesday, Thursday, and you've changed your lifestyle. So now you wear it out, and that's the idea. Those are metabolic therapies. Cytotoxic therapies would be like low dose chemo, which I use in a situation where I have the tumor blocking a vital function, or someone's having a hard time having a bowel movement, and I gotta move quickly, or they can't eat, and I gotta move quickly. I will use low dose chemo with insulin, which works not only as good as the high dose, but you don't get the side effects. So anyway, that's the only one I will use occasionally. But I'll tell you something, if someone comes to me and they've got a tumor in their brain and it's not working, I got to get them to the radiotherapist. We've got to do something. I mean, it's not that I don't, it's integrative oncology, Absolutely. Not alternative. Yeah.
Right. Totally. Yeah. There's definitely a balance there. What do you consider high dose vitamin C?
Well, and that's a good question. It really depends on the person, because our adrenal glands require vitamin C. So someone who's under a lot of stress, their adrenal glands are going to suck up what you give them. So for example, let's say I give 50 grams to 2 people. One has a therapeutic plasma, therapeutic concentration, which is 350 up to 450 milligrams per deciliter in their plasma. So if they have that, now they've reached the therapeutic level. So one person does and one person doesn't. So this other person, I might have to go up to 100 grams, right? So what I've learned really helps is to make sure that they're taking enough. See, what is known as chronic subclinical scurvy. None of us get enough vitamin C in our diets. Mm-hmm. Chimps, gorillas are eating all day long, right? And so they're getting all of this. So for them, they don't need supplements or IVs, right? But for us, we just don't. So we need to get vitamin C, about 8 grams for the average person, 8 grams a day, and you can only absorb a small amount per hour. So what you do is I get the powdered sodium ascorbate, put it in a bottle, like a liter of water, a liter and a half of water, and just sip it throughout the day, maybe over an 8-hour, 9-hour period. Just sip it. You're doing this. Maybe you're drinking tea, but you're going to have a sip of this, and then throughout the day. And then what you will do with that is now you will satisfy your physiological requirements for vitamin C. Now, when you get that IV, it can get to therapeutic concentration more easily. So high dose really depends on that. And then, of course, I mean, I've never met anybody who got therapeutic at 25 grams. So I'm thinking 50 for someone who's really got their enough orally,
Mm-hmm. No, that's great. I'm glad that you test that, because so many doctors just randomly pick a number and say that's what you need. But I know when I went through my second healing journey, I wanted to know the answer, what was right for me. And so I came across that tumor lysing range of 350 to 400 through the Riordan Clinic. And I had to go up to 100 grams for about a month, and then I could go back to 75 and then 50. But that's such an important number to know.
And one other thing that I've been doing lately, and when I say me, it's also my Arizona clinic, because I'm still the owner, and so we do everything the same. But one of the things we've noticed is that I measured the plasma ascorbate levels, and I found out that they're in that therapeutic range for at most 30 minutes, 40 minutes. Wow. So here I got a 2-hour IV, a 3-hour IV, and I got 30 to 40 minutes of therapeutic on that. Wait, what's going on? So what I realized was, well, let's go back and look at pharmacology. In pharmacology, what they do with drugs is they give a loading dose and then a maintenance dose to keep you at that level. So you've got to find out. So we find out what the person's loading dose requirement is to get them up to there, and then smaller dose and smaller dose. In fact, I think, I've not had the opportunity to test it, but I think if we could do that, and the person's in the clinic 8 hours, so they've got 8 hours at therapeutic levels, right? So let's say you get 50 grams in 30 minutes, and then you're getting 25 grams an hour for 3 hours. And you do this by you testing, and then you can go down to 15 grams an hour, whatever it is. And then now you give them if you did that once a week, twice a week, you'd be getting more, you'd be in the therapeutic range in one day more than you would in the whole year. So, you know, that's, and I was thinking, well, what if we had one of those home infusion pumps and you just did that for, let's say, 2 weeks? Maybe it's gone. Maybe you don't need anything else. I mean, I've never had the opportunity to really check that.
All right, put it on your to-do list and let me know
It's
how
on
it
there.
works out. All right. Third one is enhancing the immune system.
Yeah. So the immune system is in multiple ways turned off, downregulated by cancer cells. They produce certain enzymes. There's something called the tumor microenvironment, which has got a low pH. It's got many other things. But anyway, so even when a macrophage, a good healthy macrophage, shows up and gets to the tumor and it gets into the tumor microenvironment, it gets like a CIA agent who's in Russia, and they get turned and they start working for the Russians. Well, this is what the macrophage does, and they call them TAMs, tumor-associated macrophages. So now they're working for the enemy. So what they're doing, I don't want to use that term. I use that as the analogy for turning but cancer's not the enemy. But anyway, so it gets into the microenvironment, and now it's actually helping the tumor grow, because there are basically two, macrophage M1 and M2s. The M1s are taking bites out of the cancer and presenting it to the T cell, so the T cell can now identify it. So the T cell's a trained assassin, and now it's been given the fingerprints, the retinal scans, and all that. So now it goes after it. So that's how that works. But the tumor-associated macrophages no longer do that. It's supporting tumor growth. And the way for people to think about this really easily is, let's say I go out in my garden suddenly. I've never been there before. I mean, I have never done that for years. So I go out there and I'm raking and digging and all this, and I look at night, I've got some blisters. Well, if I stop, it's going to heal within 3 or 4 days. If I don't stop, I keep going out there and I keep re-injuring it, it's going to now become calluses. It's going to become hard. It's developing a proliferative condition to protect. Okay, so that proliferation, all right, that's why basically cancer has been called the wound that wouldn't heal, because it's basically in the second, what they call the chronic inflammation. And chronic inflammation and acute inflammation, 2 different animals. They should have 2 different names. They shouldn't even call one.
Right.
So, but anyway, so that's what happens. So anyway, what you need to do is wake up the immune system. Not what they call immunotherapy in hospitals is basically targeting checkpoints. They think if you knock out a checkpoint, and that you don't even know what that is, people, but it's another fancy name for chemotherapy. They've changed the name.
Right.
It's no longer called the Gulf War. It's now called the war against video. So you keep changing the name, but you're fighting the same people. So anyway, but it's still chemotherapy. You still have major problems from it. So what we do is we wake it up. How do we wake it up? We wake it up with something called IL-2, interleukin 2 in low doses. We wake it up with a thymosin alpha-1, which is a peptide. Amazing, easy to take. You can do it at home. Anything you can do at home and you don't need to go see anybody, it's better. TA1, thymosin alpha-1, because what does that do? As our thymus gland shrinks, okay, our immunity goes down, all right? Because the thymus gland is how we produce T cells, activates our NK cells and all that. So it just goes down. So by the time you're 60, you almost have basically a dysfunctional thymus. So you get this little peptide, very simple. So, and what I love about peptides is that peptides are just small proteins. So they're strings of amino acids. So let's say you got too much. Okay, your body digests it, and the amino acids go to your amino acid pool. There's no toxicity. It's not a, it's a thing your body would normally produce. But anyway, so it's simple. You just do it. It's subcutaneous, a little insulin syringe, like in your belly, about 10 to 14 days in a row, and then twice a week. And if you do that, you'll have T cells, natural killer cells, like you did when you were 30. Or if you are 30 and you have breast cancer, right? They've been damaged. They've been downregulated. This will bring them back to upregulate them. So we do that. We do systemic hyperthermia. Systemic hyperthermia brings them up. Meditation is phenomenal. Colon hydrotherapy. Think about it. 70%, 60% of our lymphatic tissue, which is our the head, each little like headquarters for the immune system, where the immune system makes decisions, are in the gut. They're in the gut, and if that gut is full of feces and absorbing the feces, then those lymph nodes are busy. Mm-hmm. They can't deal with anything new. So clean it out, and you free them up. That's a big deal. So the meditation, the colon hydrotherapy, eating right, in fact, all of the number one actually affect number three. The other thing is laughing and not lying. You can't lie. You can lie. Yeah, someone wore a stupid blouse. You could say, that looks great. Looks great on you. But not to a spouse, not to a good friend, a business partner, not those kinds of lying, because it's emotional pus and it'll damage you, not them. Right? So there's a few things in there that you need to do emotionally. And there's also, it's a combination of things. But I'd say the most important really is meditation. And by the way, for people that are Christian or Jewish or Muslim and think that meditation is praying to another God, it's not. Meditation is listening. So I always tell my Muslim patients, you pray 5 times a day. That's fantastic. Now, as soon as you're done, sit back, sit up, close your eyes, and listen. Listen to your breath, because that's where God is. You know, because when that breath leaves, your body turns to dust. So listen to your breath, and listen. So you're not praying to God, but that's meditation. So meditation is turning off the mind. Since we can't decide what we're going to think. Thinking happens. It's an involuntary thing, like our heart beating. You know, we don't decide to beat our heart. So anyway, if you can basically learn to do that, and a very good reason. I had a woman. Just one quick example. I had a woman with breast cancer who it was in her lungs predominantly, but also every bone. And she was brought in. She just came from her oncologist, who, let me call him a sorcerer, who committed. He told her she had 3 weeks to live. She came in on a gurney into my clinic, and she was there, and she had oxygen and all that stuff. Now, she had seen my videos. So when I walked up to her, she grabbed my arm and she said, "Thank God, now I know I'm going to make it."
Wow.
8 weeks later, she was jogging to our clinic, and her husband would follow her. But 8 years later, I get a postcard from Paris. So what was the difference between her and this person? She didn't say, "I believe it." I know it. And there's a difference between believing and knowing. Remember, believing always implies doubt. I believe you. Well, I doubt you. I believe you. I doubt you. I believe in Santa Claus. I don't believe in mountains. I either know about mountains or I don't. So that which is true, you know or you don't. That which is not true, you can believe or not believe. So like politicians, you can believe them, right? So anyway, so that's it. And I think my job, the protocols, you put that into a software program, you can get someone to come up with an algorithm, you know, you got the protocols. That's not the big deal. The big deal, my job, is to inspire and teach and inspire. And I need to teach people, I need them to know that this body, cut it and it heals. This body can heal, okay? And once you know that, once you know it can heal, and all you got to do is get out of the way, it heals. So now you know that. Once you know that, you don't even need to come to our clinic anymore, really. You just need to know that. It's very, very powerful. And what's another word for knowing something that hasn't happened yet? It's called faith.
Mhm.
That's basically the real definition of faith. So anyway, so that's how the immune system is dealt with.